about Parkinson's disease. Okay, what is Parkinson's disease? Parkinson's disease is a disorder that affects a small region of the brain, which is cerebellum, that located at the back of the head, which it controls movement, posture, and balance. Okay, who named this Parkinson's disease? Okay, this Parkinson's disease is named after a British doctor who is the first one who wrote about the disease, which is Dr. James Parkinson on 1817. The other name for Parkinson's disease is paralysis agitans. Okay, the terms of agitant here is referred to tremors, which is shaking. Palsy means weakness and paralysis means paralyzed. So, this condition is considered as a disorder of tremors and weakness. What is the causes of Parkinson's disease? Let me tell you. Parkinson's disease is caused by a loss of nerve cell in the part of the brain called substantia nigra. So here is substantia nigra. So this cell is responsible in producing a chemical called dopamine. So here is the function of dopamine in our brain. Okay, if this nerve cell die or damage, the amount of dopamine in the brain reduce. This means the part of the brain that controlling the movement cannot work as well as normal and causing the movement become slow and abnormal. Second causes is genetic. Parkinson's disease can run in family as a result of faulty genes passed to the child by their parents. But this disease is very rare to be inherited. The third causes of Parkinson's disease is other progressive brain condition, such as progressive supranuclear palsy, multiple system atrophy, and corticobasal degeneration. Other causes is cerebrovascular disease, which there are a series of small strokes that cause the part of the brain to die.
Good day to Madam Hidayati and also my fellow friends. I'm Yoga and I'm going to explain about the pathophysiology of Parkinson's disease and also the symptoms. Let's start with the first slide. Here is the pathophysiology of the Parkinson's disease. Parkinson's disease is still considered largely idiopathic. It is involve the interaction of host susceptibility and environmental factor. And also a small percentage of the cases are genetically linked and genetic factors are being intensively studied. Okay, physiologically the symptoms are associated with Parkinson's disease are a result of the loss of a number of neurotransmitters, most notably dopamine. And here there is a two major neuropathologic finding in Parkinson's disease, which is loss of pigmented dopaminergic neuron of the substantia nigra, and also the presence of Lewy body and Lewy neurites. And second is loss of dopamine. The loss of dopamine neuron occur mostly prominent in the ventral lateral substantia nigra. Approximately 60 to 80 of dopaminergic neurons are lost before the motor signs of the Parkinson's disease emerge. And Parkinson is increasingly seen as a complex neurodegenerative disease with the sequences of progression. There is a strong evidence that is a first effect, the dorsal motor nucleus of the vagal nerve and also the olfactory bulb and nucleus, then the locus coeruleus, and also eventually the substantia nigra. Okay. Some individuals who were thought to be normal neurological at the time of death are found to have Lewy bodies on an autopsy examination. These incidental Lewy bodies have been hypothesized to represent the pre-symptomatic phase of Parkinson's disease. And this prevalence of incidence increased with the ages. Okay, my second slide is about symptoms. First of all, we could notice tremors. Tremors means it's a kind of shaking in our hands. Okay, usually begin in the limbs, often to hands and fingers. Also, we can rub the thumb and also the four fingers back and forth, known as the pill rolling tremors. And also, hand may tremble when it is at rest. Even if during rest time, it could be shake like this. Second is bradykinesia. Bradykinesia is a slow movement. In over time, Parkinson's disease may slow the movement, making a simple task difficult and also time consuming. It will take more time to make a movement. Even a very small, to step forward, it might took a long gap for them to perform. That what's mean by bradykinesia. Third is rigidity, muscle rigidity. Muscle stiffness may occur in any part of the body. The stiff muscles can be painful and also limit range of the motion. Second is impaired posture. Impaired posture means the posture may become stoop or may have a balance problem as a result of Parkinson's disease. The next is speech changes. Speech changes we could may observe. They may speak soft and also very quickly, or else we could notice some slow speech, or else they are very hesitate to speak or before talking, and also speech may be more of a monotone rather than ever usual inflections. Okay, the next point was writing changes. Writing changes means it may become hard to write, or else we could notice writing may appear too small. Okay, the last point was loss of automatic movement. Loss of automatic movement means they may have a decreased ability to perform unconscious movements, which includes blinking, eye blinking, and smiling and swinging arms whenever they try to walk. These are the most noticeable symptoms of a Parkinson's disease within a patient.
Assalamualaikum and good evening. So today I will be presenting on diagnosis and treatment for Parkinson's disease. So for diagnosis of Parkinson's disease, there is no test that can determine the Parkinson's disease. So what the doctor will do, the doctor will find the diagnosis based on the symptoms, medical history, and some of the physical examination. For the physical examination, the doctor will identify the certain physical signs and symptoms that usually can be seen on the Parkinson's disease. First is shaking or tremor. Second is bradykinesia. Third is rigidity. And fourth is posture instability. There is no lab or imaging test that is recommended to determine the Parkinson's disease. However, in 2011, the US FDA approved an imaging scan called the DAT scan. This treatment will allow the doctor to see the detailed pictures of the brain dopamine system. How the DAT work? The doctor will inject a small amount of radioactive drug, and there will be a machine called a single proton emission computed tomography scanner, which is similar to the MRI. The drug injected will bind to the dopamine transmitter in the brain, showing where in the brain dopaminergic neurons are. If there any loss of dopamine, the patient may having a Parkinson's disease. However, the result of the AT can show that the patient have Parkinson, but it can help the doctor to confirm a diagnosis or rule out a Parkinson mimic. So next, we will go to the treatment. Currently, there is no cure for Parkinson's disease, but the treatment are available to help the patient to relieve the symptom and maintain their quality of life. So there are a few treatments that can be used. First is supportive treatment, second is medication, third is surgery. For supportive treatment, there are several therapies that can make the Parkinson patient deal with their symptom on their day basis. Where they can go, first is physiotherapy. A physiotherapist can work with the patient to relieve muscle stiffness and joint pain through movement and exercise. Second is occupational therapy. Occupational therapy can identify areas of difficulty in the Parkinson patient everyday life. For example, how they can dress themselves or how they can go to the local shops. Third is speech and language therapy. So many people with Parkinson's disease will having a swallowing difficulty and they have problem with their speech. So this speech and language therapy can help them to improve this problem by teaching speaking and swallowing exercise. Then there is also diet advice. For some Parkinson patient, they can change their dietary intake to improve their symptom. What they can change is increase the amount of fiber intake in the diet and make sure to drink a lot but enough to reduce the constipation. Next is medication. The medication used mainly to improve the main symptom of Parkinson's disease, such as shaking and movement problem. The main type of medication used are levodopa and dopamine agonists. So lastly is surgery. Most people with Parkinson's disease are treated with medication. However, there are some patients that need to undergo surgery that called deep brain stimulation if the symptoms is more severe.
Greetings and good day to Madam One, to all the examiners, and to all my fellow friends. My name is Jacqueline, and as for my part, I will discuss regarding the prognosis and the conclusion of the Parkinson's disease. So, as for the prognosis, according to an article done by the Parkinson United States, patients with Parkinson's disease have a slightly shorter life expectancy because of the complication associated with swallowing problems, for example, choking, or infection such as pneumonia, and trauma due to falls. Estimates are varied, but according to one analysis done by Dr. William Gray, the mean duration of the Parkinson's disease from onset to death was 13.7 years. The duration was shorter for those that has been diagnosed at the late age. Several factors has been linked to Parkinson's disease prognosis, including younger age of onset, the tremor dominant nature of phenotype, and the race or ethnicity. So, as for the conclusion, Parkinson's disease is relatively common, progressive movement disorder. Drugs or medication only provide symptomatic relief and give most patients an additional 3 to 6 years of happier and productive life. Although there is no cure, there are several management options for the early treatment of Parkinson's disease. Conventional drug therapy is more effective and economically beneficial than the new drug therapies. As the disease progresses, further treatment options are available. However, the management of late-stage motor complications and non-motor symptoms remain particularly challenging and will benefit from further clinical research. Thank you. That is all from me.